Better health care and how to get it. That was the focal point of a forum today, sponsored by the Healthcare Association of Hawaii, with the Democratic frontrunners in the race for governor. In tonight's Commitment 2010 coverage, KITV4's Denby Fawcett explains how the candidates agreed the state needs to tap into more federal funding, but they had different ideas on how to do it.
Hawaii healthcare providers are expecting more delays in their repayments from the state with the state's current $86 million Medicaid shortfall. Gubernatorial candidates were asked how they'd get more federal funding to help healthcare providers now and in the future to meet new Obamacare requirements. Mufi Hannemann said if elected, he'd do an audit of the state government to find efficiencies to free up more money for healthcare.
We need that. Because that's the only way we're going to be able to identify the funds that are now we're losing as a result of not being able to have the matching funds on these federal reimbursements that come our way.
The plan that's before us right now and the federal dollars that are there right now in the short term will handle the kind of money you need right now. You don't need to study whether you need money, you need it.
Abercrombie said he'd be rounding up federal funding from day one. Another concern was doctors leaving Hawaii or retiring early because of the high cost of medical malpractice insurance.
My greatest concern is that the physicians have been unified on this issue for quite some time.
Abercrombie said he'd cut medical malpractice insurance costs by having government cover doctors who treat Medicaid and Medicare patients.
And that is my idea of real reform that allows you to do your work right now, today, without fear, without anxiety.
Hannemann had no direct answer on how to reduce malpractice insurance costs, but he said the idea needs more discussion. Denby Fawcett, KITV4 News.